Welcome to the Healthcare Provider Happy Hour. This is a safe space where we invite healthcare providers to unapologetically be themselves after the working day. My name is Jennifer George, and each week I will connect you with guests and stories that will help transform your stress to success and fulfillment. Are you with me? Grab your drink of choice and let's chat. Hey everyone, welcome to the Healthcare Provider Happy Hour. I'm your host, Jennifer George, and I'm joining you today with a special guest. His name is Josh Cutler. He's a mental health professional who's worked in healthcare for nearly 20 years. He's a psychotherapist, a social worker, and a people leader. Josh's work focuses on improving access to mental health services for people vulnerable to suicide. Josh is also the author of his memoir, The Day Hospital, and here he shares his struggle with mental health and his diagnosis and recovery of overcoming and managing day to day, in the hopes that his vulnerability will lead others to seek help as well. Josh and I talk about his book, his story. We talk about the suicide risk among healthcare professionals, and we talk about the power of human connection and creating a safe space for others to share how they're really feeling. So grab your drink of choice. You don't want to miss this episode. Hey, Josh.
Hello.
Welcome. Hello. How are you today?
I'm doing well. Thanks for having me.
Thanks for being here. I'm happy to have you on the show. I've been looking forward to this conversation. I think things happen for a reason. And lately, for example, I talk about burnout on this podcast quite a bit, but I haven't been lately. But just this week, I've released a podcast episode on women and burnout. And I was referencing an article from The Greater Good at the University of Berkeley where they talked about suicide rates among female physicians. And then I thought you were coming on the show this week, and I thought, this could be a good conversation. So I thank you for being here. But before we get into that, can you tell us more about who you are?
Yeah. So I'm Josh Cutler. I'm a licensed clinical social worker based in Seattle. I've worked in healthcare for about 17 years now in a variety of settings, from long-term care to outpatient mental health to telehealth a lot the last couple of years, and have held a variety of positions ranging from administrative to clinical. And these days, my roles seem to be a mix of leadership and direct practice, which I enjoy, and having the opportunity to do both. And so I've also worked in small clinics and then also in very big health systems. My most recent role was working in the third largest health system in the United States. That's really big here on the West Coast. And I'm actually starting up a new job in the new year. So in a couple of weeks, I'm taking a little time off with my family, but then I'm starting a new job where I'm going to be working alongside primary care doctors and their care teams to be building a behavioral health service within primary care. I'm really excited to be doing that work again.
Oh, that's really cool. So are you more, when you said leadership and stuff, are you more in the hospital environment or
I've always worked in the outpatient environment.
Oh, okay.
But I have a lot of colleagues that work in the hospitals. And often when people hear social worker, especially when they work in healthcare, that's kind of the first thing that they think of, the amazing social workers that work in the hospital setting. But I've always been more on the outpatient mental health side when I've done clinical work. And so worked closely with psychologists and psychiatrists and mental health counselors. And so that's most of my work as a psychotherapist. And then the last couple of years, I led a large telebehavioral health service that we actually turned on to take care of healthcare providers. We built it before COVID with scale in mind. And then COVID hit. And we were very busy. And so what you mentioned earlier about the suicide rate of female physicians, that's very close to my heart. We lost a number of physicians to suicide in our health system, and not just physicians, other specialties as well. And and it's just been really painful. And so part of my work was in response to that, to create more robust offerings for our caregivers, to be able to reach out for help and actually be able to get a trained therapist on the phone within a few days, if not the
Yeah.
same day. And so that's been kind of my specialty in the last couple of years, actually, healthcare providers, and it's something I'm really passionate about. And so often we're great at helping our patients, but not so good at taking care of ourselves.
Yeah. And I mean, I think that's great that I don't know if scaling is the right word, but that's kind of how it's like happening in a sense that there's such a great need right out there. One of the things, I mean, I usually prepare questions to ask in advance for my guests, but today I really wanted to just have a conversation because I think this could go in so many different directions based on your story, based on you being a healthcare provider as well. So, are you noticing that healthcare providers are coming forward and asking for more help? Because I sometimes think that, and speaking from personal experiences too, that there's a stigma, right, around healthcare providers seeking help because they don't. They don't want to be judged for seeming unfit, or they don't want things to be documented, with their name being attached to any type of illness, right? So are you noticing that the stigma is kind of, dissolving a bit or no?
I would say yes and no. I would say
Okay.
on the one hand, we're talking about it a lot more. I think it's just in everybody's face that like COVID has gone on for so long, and the healthcare providers on the front lines, many are experiencing PTSD and anxiety, and just even those that don't have those diagnoses, it's really stressful. I mean, I'm
Hmm.
friends with a lot of people that are continuing to work in the hospital, and just hearing the stories that they tell, and especially those early days when we didn't really know what we were dealing with, and they would
Hmm.
come home and have to like undress in the garage and run right to the shower,
Yeah.
and not want to get their family sick. I mean, that takes a toll. And so I think people are more openly talking about their stress, because I think in the past healthcare providers have felt like, well, I need to keep this to myself because all the other people around me are strong, and certainly the training model for physicians has been to kind of be the tough one and kind of tough
Yeah.
it out.
Yeah.
And so I think that there's been this idea of it's okay to not be okay. We've certainly democratized suffering. That, wow, this has been really painful for everybody, and we're all talking about how difficult this is. And
Yeah.
so as painful as that's been, I think that's been a positive. Now, there's still systemic barriers related to even seeking help, and then having to, I'm licensed in a few states here, and I don't know if you guys have national licensing in Canada, but here it's state by state, and so every state's different as far as what they want you to fill out, and they ask specific questions about, like, have you been treated for a mental illness, like like one was like ever, or in the last 10
Wow.
years or something, and I have, and so but I felt like I had to get a letter from my doctor, and like, and I wasn't actively having any trouble, but it was like it wasn't affecting my work, but I'd gotten help a long time ago, which I think actually makes me better at what I do. And I'd rather
Wow.
get care from somebody that got help versus somebody that's avoided ever getting help. And so I know that there's people, I mean, I talk to people about this issue, and they won't get help for that very reason. They're just afraid it can affect your livelihood big time. And some of the states here are starting to change those rules so that people aren't being asked those questions so directly. It's more related to, do you have something going on with your health that impacts your work in any
Okay.
way currently, which is important to check in about. But the fact that someone got treatment for drinking 10 years ago and has been sober, or it hasn't been an issue for them for a very long time, I don't think that's anybody's business. And and
It's
so it's hard. I think we have a long way to go. The things that are like baked into the system, but I think just
yeah.
the fact that people are talking about it is big.
Was that the intention of the system in asking those questions though? Was to not was to exclude people who have been ill? What do you think that was the intention of the system?
Yeah. I mean, there's so many things that are baked into the system around patient safety
Oh,
that,
okay.
in my opinion, end up causing so much red tape of
Mm-hmm.
leading
Mm-hmm.
to some dangerous levels of burnout. Just the level of documentation, for example, that, the amount of time doctors spend in an electronic medical record, not just doctors, all healthcare providers.
Mm-hmm.
And that ends up potentially leading to healthcare errors other places. Yes, the documentation is showing high quality care, but the doctors are so fried and might
Yeah.
be making mistakes other places
Yeah.
because they're spending so much time in front of the computer. And so that's an example where some issues are being caused by that stuff.
Uh, I could see that just experiencing electronic documentation myself and having it be
Yeah.
newer to my practice. I work in hospital. It's
Mhm.
something that I've had to and still have to continue to get used to. It's a different way of
Yeah.
communicating,
Yeah.
just paper pen. So, like, I just want to show the book if that's okay with you. Your book, The Day Hospital. You can see it's
Yeah.
tabbed. I was telling you earlier that
Wow.
before we
You
started
really went
recording,
for it.
that's only like half the book because I truthfully haven't read all of it yet. But like I was saying, when I read something, it's almost like I study it in a way, and I really try to empathize with what I'm reading. And yeah, I was just getting carried away with the tabs, Josh. So, so I know
I'm
this is.
flattered. It's my life story, Tab.
Oh, jeez. So this is your second edition.
Yes.
Tell me
Yes.
why. Like I love the power of your vulnerability in this book. Like it to me, it's just incredibly moving, and I do think it's going to liberate other providers, especially male or female, to share their own story, whatever it might be, their own journey, whatever it might be. I hope, and to seek help if they need it. But tell me why you wrote the first one anonymously. Like, was it you just weren't ready to be vulnerable enough to share your name to it, or what was that about?
Yeah. um,
Yeah.
it's been an intense process, and
Mhm.
it's been really a long journey to get to the point where I'm at with it now. And I would say that early drafts that I shared with other people who were close to me, who knew some of these stories and maybe didn't know a lot beyond that. And I was kind of entertaining a pseudonym. But I had a couple of people say, you really might want to write this under a pseudonym. This is really personal. I was in a place in my career where I felt like I was still establishing myself, especially in leadership roles, and I just didn't want to have any question about my judgment or my skills or my ability to do the job. And I write about in my book just that I benefit from a lot of privilege being a white man and
Mhm.
suddenly having a serious mental illness diagnosis attached to my name. Some of that gets taken away, and I'm aware
Yeah.
of that. Mouths to feed. I've got two little girls and family to support. So that all kind of went into that thinking, and in a way, it really helped. But I was really wanting to publish it, so I was able to get it published anonymously, and I didn't use a pseudonym because that felt a little strange, and ended up just blacking out my name and all the reference. And I made a point about that in the introduction,
Yeah.
and I explained why, and it felt like it almost still looked like a redacted document. So that was basically where it started, and then I shared it with friends and family, and I don't know, probably a couple hundred people read it, and I just got really positive feedback from people, and it
Yes.
led to some really meaningful conversations with people in my life, some of whom I knew, some of even knew pretty well, but I didn't know that they'd gone through serious mental health challenges. And I reconnected with like some old friends from high school and college that I'd sort of lost touch with, who'd had their own challenging journeys,
Mhm.
and now we kind of had this thing in common, and it's really enriched my relationships, and so that's was sort of the flip side of the fear of all the bad things that could happen if I'm vulnerable. It's like, oh, actually, my life got richer, and
Yeah.
and I'm not so scared of this being found out. And I shared it even with the people that I worked with my boss and others, and it just was like, yeah, this is what I'm dealing with, and so that was really liberating. And then I got to the point just in the middle of COVID where it was just like, okay, we need to have more of a conversation, as a society about mental health. And people that have experienced positive success related to treatment often don't talk about it. Like, we're everywhere. Like,
Hmm.
a huge percentage of people in North America have gotten mental health treatment of some sort, whether they're taking medication or have got therapy or both, some combination. Like, it's not an insignificant amount, and so and I know that in just the numbers of people that I see in my practice that you would see walking around, you'd think they're totally fine. And so recognizing that, me as somebody who's been through some significant challenges, and come out relatively whole on the other side with a story to tell. I felt like that should be shared, and I also found it was really hard to promote an anonymous book, and so it was kind of I was wanting to promote it a little bit more and actually sell some copies of it, and so it was like, all right, I got to put my name on it and and get out there. So that's what I've been doing, and I haven't looked back.
Oh, that's awesome.
And but I'm glad I still warmed up to it. I wouldn't recommend just totally putting all of your tough things that have happened in your life out for the world to see right off the bat. So
Yeah, that's what I was going to say. We talk, there's a lot of talk out there about vulnerability, right? And it's something I struggle with too, like personally, to be like vulnerable and open. So I really appreciate how you did it on your time and,
yeah,
in your way. And you kind of didn't know that you were going to probably have a second book, but like, that was published by you
yep,
about your story, but
yeah,
that it just evolved into that, and I think that
yeah.
that's great that you just went with it. So I wanted to quote something that a lot of people might be feeling when they've thought about maybe talking to an employer about going through something, struggling. So if that's okay with you, I'm just going to quote this one part from the book. You ready? Um,
Sure, yeah,
it's when you're about to tell your boss that you were going to basically get help and that I think you needed
okay,
some time. Yeah.
yeah,
So just a short quote. So you go to say, would this admission lead to questions about my competence, my resilience, my ability to take on tough challenges and see them through? Would the promotions end? The conversation was short, and he was very supportive, to say the least. So, can you tell me what that moment was like for you to have, to actually have the courage to share this? Because I can only imagine, like you said, you were kind of rising up in your workplace, and yeah, you were
hmm
probably worried about losing all of that.
yeah, definitely. It was, and I should also preface this with, I worked at that point for a lovely psychiatrist who's a big mental health advocate. So this is like his
Yeah,
world. So,
right.
so I knew it was sort of a safe place. But I've also worked for other bosses in the past that I felt like they talked about mental health and stuff, but I just wasn't ready to ever talk about this stuff. So I didn't have to. I want to make it clear to people that you have legal rights where your employer does not have to know that, if you get the documentation from your doctor that you need time off for health related reasons, you can take that time off. And I know whatever country you're in, it's a little bit different, but I know that but that's a piece of it. Like, you don't necessarily have to be upfront. But for me at that point, it just felt like, I want to share this. This has been frankly going on for a while. It's been
Hmm.
exhausting. It's exhausting to live with serious mental illness, and one, just be dealing with the symptoms of it, and then two, dealing with managing other people's perceptions all the time. I'm
Yeah.
really good at acting like I'm okay, and that takes up a lot of energy. And so to just be able to let my guard down a little bit, to be able to say, really, actually, I'm not okay. I need to take this time. I don't know what's going to happen on the other side of
Hmm.
it. And actually, I came back stronger, and we went on to create some really amazing programs. I did get promoted,
That's
and
awesome.
and I have a new job that I'm starting in a couple weeks, based that I'm really excited about. That's a big step up for me. That's I was offered on the grounds of all the work I'd done in the past, and so it actually had, for me, led to some good opportunities. and I think frankly I had relationships with my boss and others and people knew that I was, um, I had a lot to offer and was working hard and probably working myself too hard at that point. And so I would just encourage you before you are at a point where you might need to have this conversation with a boss, building a relationship with them. And it doesn't have to be super personal. There can be certainly boundaries around it, but just getting them know them a little bit and even finding little ways to just mention that your stress is getting to you or other things and anybody that I would want to work for at this point in my life would be supportive of these things. I know that's
Hmm.
not always the case for everybody, and certain times we just need to stay in some jobs. But I think in the long run, for any of our mental wellness, it's good to be in an environment where you're going to be supported because at any point, someone in our life that's really important could pass away or get sick, or we need to be able to live our lives. And I think it includes not just taking care of other people, but taking care of ourselves.
Yeah,
Uh,
I think that's hugely worth stating, though, is that I think you kind of know, at least I did, when you have an employer who you can't feel safe with or you don't feel safe with,
mhm.
and the difference between the two. Like, I think you just know if you do feel safe enough, and
Yeah,
thankfully you did. And I
yeah.
do think that's one of the big factors people have to look at when they stay in a job that they're in.
Hmm.
Is the relationships you have in the workplace too, for
Hmm.
sure. Yeah, we spend so
Yeah.
much time there, eh? Like,
Yeah, that's for
you
sure.
know what I
Yeah,
mean?
yeah,
You got to enjoy the company too.
yeah.
So, who would you say this? Who would you say your book, your story, like when you were writing it, is intended
Hmm.
for? Like, who are you thinking about?
Well, I think it's a range of audiences. I would say one is for because it's kind of a coming of age story. I talk about kind of my early experiences, kind of growing up, and then my struggles in college, where my challenges with depression hit really hard. And so I think young people that are struggling with a new diagnosis of
Mhm.
depression or bipolar disorder or anxiety disorders, to show that there's hope that just because you have this diagnosis doesn't mean that your not life is not going to become of anything. Like my life is still hard. I get depressed sometimes. I
Mhm.
may struggle really hard with this stuff more in the future, but I also have a nice home and a lovely wife and beautiful children and work that I enjoy and some good friends and hobbies, and there's a lot of good in life. And also I think for parents or friends of people that are going through a serious mental health crisis that maybe are looking for a way to understand like what's going on. I think this is a way to do that. I try to be pretty relatable in my life generally, and I try to come across that way in the book. And so I'm just like a regular guy that's been
Yeah.
through some some tough stuff, and so I hope that like if someone's I've talked to some parents whose kids have struggled with serious mental illness who said that it was really helpful to kind of see this perspective and help them understand and give them a little bit of peace. And then also I write specifically for healthcare providers. A couple of the chapters I added in the new edition were related to my own
Okay.
experience of working during COVID in healthcare, and especially supporting nurses and physicians and other healthcare professionals emotionally, and what that was like. And I wanted to make sure it felt like this big thing had happened that was not featured in my first edition, and so I wanted to add some of my thoughts on that, and so that's in there as well.
Wow. So yeah, like I felt like when I was reading the book, I felt like you were just telling me the story. That is how I felt. Like you said, it's super relatable. Like even your thought process and your reflections on your thoughts and your feelings. In some ways I could relate to too. Can
Hmm.
we talk a little bit about? I know you shared very powerfully a couple of incidences, in your college years where you did attempt to take your life, right?
Hmm.
And can we talk about that, like now when we talk about healthcare providers and how, like,
Hmm.
if anybody can relate, it's going to be you. And I think, like you said, I think if anything, like it makes you more empathetic to the situation,
Mm,
right? Because truthfully, like I wasn't super aware of this until COVID hit, that it was this bad. When I had read the headline about the New York ER doctor who took her life,
yeah.
that story just killed me. Like I just couldn't
Mm,
believe that. And then we also lost, I'm a physiotherapist, or a physical therapist, is how it's termed in the States. Lost a local physical therapist to suicide too, not that long ago. And so,
sorry to hear that.
yeah, so it's tough, and I don't think we talk about it enough. Like I don't think people are comfortable talking about it. I know it's hard for me to talk about, but I
Yeah.
think it's something we have to start talking about and normalizing the conversation around it so that people can feel more comfortable sharing and
Hmm.
supporting. So, can you give any insight on on the experiences of healthcare providers?
Yeah. Well, for one, yeah, this is really hard to talk about. It's something that our culture struggles to talk about.
Hmm.
And also it's something that healthcare providers outside of behavioral health are not given much training to talk about with their own patients even. And so
Oh
that's
yeah,
been a big part of my work, educating healthcare providers on like how to talk with their patients about this. And it's not just like psychiatrists. Like
right.
it's
That's so
usually we
true,
know
though.
somebody's having these issues if they're seeing a psychiatrist, where it could be that they're seeing a I'm going to call you a physical therapist because you'd be here,
Yeah, all
um,
good.
and or their primary care doctor, or there's statistically big number of folks that die by suicide have seen a healthcare provider in the month before they died, and so often we just don't ask about it. And people are afraid, like, well, if I ask, and then they endorse suicidal ideation, what do I do? And
Hmm.
so I think that's part of the conversation that I'm really invested in right now. There's a concept called zero suicide, and there's a lot of work happening um, across the world, really, in healthcare around it. How do we, what's the acceptable number of suicides when they were trying to figure out a name for this thing? They decided,
Oh my
well, zero.
goodness.
That's what we're shooting for. And
Oh my
and
goodness.
so the first step is routine screening, especially when there's a concern, and education for people that may be running into these folks, and to how to have these conversations. So there's some really great programs out there that if they're not doing them in a setting that you're working in and you're concerned about this, it's something that I would really recommend. And part of it is just finding some language to be able to talk to your colleagues if you're concerned, and to be
Hmm.
able to like ask about certainly suicidal ideation if that's something that you think might be on the table. The, the worst case sometimes would be that you might bring it up with somebody and they'd be a little offended or embarrassed, but that usually it's more of the other side, that they're maybe struggling with something, but they haven't known how to talk with anybody about it, and it can lead to a conversation where I talk to a lot of people about suicidal thoughts. Most of the time, people are not at imminent risk of harming themselves, but that once those thoughts get going, especially for healthcare providers that understand human physiology, and
Hmm. Hmm.
um, and that's part of why female physicians are dying at such high rates. Is that women actually across the general population attempt suicide at much higher rates than men, but they often don't die by suicide, whereas men have access to guns and often at higher rate than women, and
Hmm.
often are more likely to die that way, where female physicians understand if they're wanting to do this. I recently learned veterinarians actually are at very high risk for suicide, and there's a mental health pandemic in
Wow.
veterinary, because they are used to putting like animals down and know
Oh
how to
yeah.
do that, and a human is a big animal. um,
Yeah.
and to have a some education that's regular and ongoing, that okay, we talk about this stuff, we understand that people sometimes have these thoughts that are difficult, and we want to make sure that people aren't acting on them. I mean, that's the big
Hmm.
thing. Like suicidal thoughts are pretty normal. People feel hopeless at times. They don't feel like there's any way out, and that's something to get focused on. And it's good to get those addressed as soon as possible. But really, especially when people start to then have a plan for how they're going to carry that out, make sure people are getting the same level of attention as they would if they were having a heart attack,
Right.
because it's really
Um,
dangerous.
right. Especially if left unheard or, spoken about. You just made me think about something actually. Just I've been practicing for 14 years, and there's so many questions we ask, during an assessment, let's say. And we don't, I know that lately I've been asking about mood. Like I will ask
Mm-hmm.
my patients, so how's your mood been? But it's not something that I could say has been standardized, right, in our practice
Mm-hmm.
to ask about
Mm-hmm.
things like that. We talk about, let's say, like recreational substances and things like that, but we don't talk about someone's mental health at all. Like we've
Mm-hmm.
totally don't, and like you said, we think it's, psychology or psychiatry, that we're kind of siloed that way, but really it's
Mm-hmm.
just a matter of having that rapport there, and you could be
Yeah.
anyone, right? And if someone's opening up to
Yeah.
you, we should be more informed as to how to handle that, and yeah, how to help others get help, essentially.
Yeah. And I think being able to make sure that those providers, if you're going to start asking those questions, like have the resources to be able to refer to. And
Hmm.
can most of the time, people are just going to be grateful to be able to talk about it.
Right.
If someone's depressed, they're not going to be following through on the stretches and other things you're asking them to do at home.
Exactly. So
And
true.
so it's good to know that, right?
Yeah.
And
Yeah.
so like, oh well, it sounds like you stopped taking your antidepressant a couple weeks ago, and you haven't been consistent seeing your therapist, and that's impacting
Hmm.
our care. Like,
Hmm.
having that kind of more holistic approach. That's what I love about working in primary care, where some of the stigma also of going to a specialist for mental health problems is taken away, where I'm just part of a doctor's office visit, and they can talk
Okay.
with me as they would talk to their regular doctor. I'm just an extension of that care team.
Yeah.
Um, because, yeah, so often, so many people just wouldn't even go to psychiatry or to a mental health therapist
Yeah.
or clinical social worker, but they are up for talking to their primary care doctor or other providers on their team about these things. And so to be prepared to give them good resources to respond if someone comes in crisis, or if somebody comes in and they're just, you're used to seeing them and they're
Hmm.
usually present one way and just they're really different one time, like being able to have the questions to ask, to be able to check in, like, hey, what's
Right.
different for you right now? What's on your mind? Is there anything we should be concerned about? You don't have to just ask right directly, are you thinking of hurting
Right.
yourself? But you kind of warm
Yeah.
up to that. And that's why it's just so important to have relationships with your patients.
Yeah. One of the things I've said for a while now, is that if I ever went back into private practice, like I'm fortunate now, I work on an inpatient rehab unit, so it's
Hmm.
very, interprofessional, and I
Hmm.
can refer to a social worker and psychologist if I need to, or psychiatry as well. But I've always said, like recently, that if I were to go into private practice, I would want a social worker. Like I would hire social worker or psychology like before another physical rehab professional, basically, because
Mm,
being in the hospital environment, I see how significant it is, especially now
yeah,
in the last couple of years. Like, it's not very rarely now is it just physical, as a
yeah, yeah.
physiotherapist. So yeah, it's definitely seeing the layers.
Or I would just say that's part of a lot of people's training now too, and working in these interdisciplinary environments. So I think we're going to see it more and more. And it's just professionals demand it. Like
Yeah. Yeah.
they want it. Yeah.
Yeah, like everything in healthcare, things take time too, right, for the system to kind of eventually catch up and change. So, what is your advice for healthcare providers who are struggling right now, who are feeling burned out, Josh, who might be feeling where you once felt, between, liking their work, doing their work well, but also struggling on the inside too, losing themselves? and having personal responsibilities. Like, what is your advice for them to kind of start moving forward or finding help?
So, for one, I would say that if you're feeling bad, if you're struggling, if you're burned out, it's not only you. A lot of people are feeling this way, and I don't want to say that in a hopeless way that this is the only way to feel, but just to normalize it. Um,
Right.
that that this is that the environment you're working in is not conducive for human thriving, and
So
and
true.
we're working on that, but it's not. But also, you've invested a lot in this profession, a lot of education, a lot of time, and a lot of passion, and feel like you're going to throw it all away. Um,
Hmm.
and so, finding some smaller ways, I would say, to slow down and to take care of yourself and the people around you, taking stock of what's really important to you and what in the job gives you the most joy and satisfaction, and making sure that you're doing some of those things every day. I think people that went into healthcare careers often sacrificed a lot with this kind of promise of, well, you're going to be living your bliss on the other side of it, and
Right.
you're going to be joyful at work every day. And we look at other people or young people that are thinking about going back to school, and they want to interview us, and kind of thinking that, on the other side of this, I'm going to be happy all the time. And the reality is, it's still work, it's still
Yeah.
life, and there's still paperwork forever,
Yeah. It's not
and
going
there's
away.
still, and there's still, we still have difficult thoughts and feelings as humans. We still have to work with other people who are often difficult, but
Yeah.
also wonderful, and so just in some ways accepting the reality of where you're at, and looking at, okay, what parts of this can I make work better for me, to give me the things that I need to really practice the way I want to practice, and also live the life that I want to live. And
Hmm.
it's so important to find that
Yeah.
balance also for your personal and your professional life. It can be really easy to have it get so out of balance, and so, that may be, if you have the opportunity to work a little bit less, or if you have a spouse that you can carry the load with financially a little bit differently. We've been kind of reshuffling things in my household this year, which has been, I think, good all around. And
Hmm.
but we, have the privilege to be able to do that. I would say not everybody can. And certainly, I was raised by a single mom who worked a lot, who um, didn't always, have the opportunity to just turn down work because she needed to chill. So,
Yeah.
so I get what that is when people just feel like they need to take on extra shifts to be able to take care of their family. But I would also look at your overall wellness and say, okay, yeah, I'm working these extra shifts for my kids, but maybe I don't need to take all of the extra shifts. Maybe I can have some balance, because the reality is I also need to be home and be present to my kids, not just
Hmm.
for them, but for me, because that's the
Hmm.
point of life, to be engaged with our loved ones. They say
Yeah.
that we're not going to wish we went to work more when
Yeah.
we're on our deathbed.
It's so true. It's
so,
so true.
um, so those are some areas that I would highlight, and also, like, if you feel like you want to get mental health support, like, I'm a mental health professional. I hope that we're starting to come out of the shadows more as not being so scary. Like, we're not going to make you talk about your mother the whole time or send you right to go on medication. Now,
Hmm.
there might be some stuff going on with your mom, and medication might be helpful, but that's, it's not so black and white. And there's, a lot of really good approaches to addressing human distress, and a key thing is just finding a safe space, and that's not always with a professional. It can be with a friend, a family member, just a place to let your hair down a little bit and share, kind of be really real about what's going on.
Yeah, I think that goes a long way, what you just said there at the end. What do you attribute to your wellness? You've been through some dark times, and I'm sure you've questioned whether you would make it out on the other side. So, what do you attribute to your wellness today and staying well?
I attribute it to partly some grit um,
Yeah.
of
Yeah.
I'm going to keep going,
Yeah.
and I'm also now recognizing that that can sometimes get me in trouble because sometimes we keep going and going and going when it's okay now, I can relax,
Yeah.
and I think I have amazing friends and wonderful family that I'm so grateful for. I have not been on this journey alone by any means, and so that's been just a key part of my experience.
Mm.
And I think also it's been a journey of acceptance of accepting, wow, I've been through some of these experiences. I talk a bit about my experience with medication. I still take medication.
Mhm.
It's something I'm pretty ambivalent about, but it's like, you know what, it seems to be helping me right now, and more about focusing on living the life that I want to be living.
Mhm.
And, I'm not like perfectly well. I've got high cholesterol that I'm working on and other things, partly from just sitting and snacking too much the last couple of years. And,
Like everybody
and,
else.
and, and yeah, exactly. Exactly. But I think I'm getting clearer in my life about what are the important things to me, and continuing to orient my life towards those things and letting others fall away. But also recognizing that I have some things that I'm really passionate about that are really important to me around changing the conversation about mental health care in this country, and that takes a certain amount of stress and energy to be even having these conversations,
Mm.
to be a little bit more vulnerable. But I'm glad to be doing it because it I think leads to a more authentic world, and that's one I want to be part of.
Yeah, and I think that's one thing we all want to be part of. And I thank you for leading the way. And you truly are a leader, inside and out. So I appreciate that so much. One of the things I will say, support is so important. But your resilience, when I was reading the book, there were moments where I was reading, like when you pulled up to the day hospital, for example, and when I was reading your inner dialogue, I thought, like, you did this alone, though. Like, you took that initiative and your wife was super supportive, but you made the decision to ultimately get help. So
Yeah,
thank you so much for doing that. And thank you so
yeah,
much for,
yeah,
like I said, leading and sharing your story. And I think
yeah,
that, when I talk a lot about education and stuff, and I really wish these types of stories and books were required readings in health
yeah.
education, because rather than just textbooks, Josh, because I think these are the types of stories. Your story is one that needs to be read in order to understand human connection and
Yeah,
yeah, and the healing of
yeah.
that. So thank you so much for being here. And where can people reach out to you, follow you, buy your book?
So there's a little information about me on my website, joshcutler.net. The best way to get my book is actually on amazon.com. And those are kind of the key ways to reach me. I'm at
Beautiful.
on Instagram at Josh Cutler, LICSW. And
Nice.
you can find me on Facebook as well.
Awesome. So we'll attach that to the show notes for people to reference. Thank you so much again for being here. Thank you for your
Yeah.
time. I hope we keep in touch.
Thanks for having me.
Okay. Yeah. Take care. So if you guys like this podcast, please subscribe and leave an honest review. Your feedback means everything to me. Your reviews are what moves this podcast forward, and I always appreciate receiving them. If you want to get a hold of me directly, reach out to me on social media. My handles are in the show notes, and you can always subscribe to my weekly newsletters at jennifergeorge.co so that we can stay connected. So until next time, thank you guys so much again for your ongoing support.